Hello everyone, you are all welcome to lecture number 1189, and today's topic is the scientific approach to stop urine leakage. And urine leakage is actually urinary bladder problem, and this problem is usually in senior citizens, mostly above the age of 50-60, and the urine leakage is common in senior citizen, but in female it is more. The chances of urine leakage is more in females as compared to male. And actually when we are talking of urine leakage, it is having sometimes some social stigma or problem, or people are not not going to doctors, to anybody. But it is wrong. If you have such type of symptom where time to time by any pressure or some maybe conditions you are experiencing such type of leakage, you may consult your urologist or nephrologist. Mainly, two conditions are there. One condition is related to your lifestyle, your weight, your food, your drink, all these things. But second one is, it can be because of some bacterial or viral infection, or maybe because of diabetic condition, or maybe some neurological problem. So these can be by infection, and in that case you consult your doctor. But if we are talking of urine leakage in female, that is actually it happens when the female becomes pregnant, and during pregnancy lot of hormonal changes are there, and some of the hormones, more especially progesterone, that is female hormone, estrogens, they are increased, and lot of weight growth of the baby, that is infant, all are responsible for creating pressure on the bladder. And that is the reason that during pregnancy and after pregnancy, female, they get the urine leakage. And secondly, that is menopause. That menopause is also one of the reason for female to have such type of symptom of urine leakage, because of the decrease in the production of female sex hormone, that is called progesterone, and because of that the nerves which are controlling all the sensation and maintaining the urine in the bladder becomes weak, and that is the reason that's why the female they get urine leakage during pregnancy and during menopause. And in the case of male, the first, if you are having urine leakage and if you are going to doctor, he will advise for prostate gland enlargement, to check it by ultrasound or by CT scan. And once the prostate gland is enlarged, it creates pressure on your bladder, and because of that pressure you will be having sensation or feeling of urination, and that urge of urination followed by leakage. And also in that case, even if you are sitting in any party or with your friends, if there is laughing or sneezing or some standing all of a sudden or holding anything, that can also cause some type of pressure on the bladder, and it may follow the leakage. I mean, that urge of the urination followed by leakage. And also the one factor that is related to lifestyle, that once your bladder is irritated due to some drink, and those drinks which are identified to irritate your urinary bladder, that is carbonated drink like Coca-Cola, Fanta, so many carbonated drinks are there, caffeine, coffee. These all carbonated drinks, they can irritate. And also any other drink apart from this identified one, if you are having leakage at any moment, that may be due to the irritation of your bladder. The other factor is, that is, you have to maintain your weight. Extra weight is also one of the factor of chances of urine leakage. And the other factor which is related to neurology, means that if you have some neurological disorder, means your nerves are not functioning properly, because everything, all messages to your brain is carried by nerves and it goes to every part including the bladder. And once they are weak, there is maximum chance of urine leakage. So these are all factors. The other factor is, that is constipation. If you have regular constipation, means your stool bowel is stuck in your intestine or near your anal, that your urinary bladder and anal is closed, and it can create some pressure of sensation, and you may get urine leakage. For that, the best thing is that avoid acidic food, means red meat or any type of other heavy food, means protein, and shift to light food, that is your mostly fiber. It will help in the leakage of the urine. And there is very, very important exercise that is called pelvic floor exercise or Kegel exercise. I will show you the type of exercise that is very, very effective, because in old age, after the age of 60, usually our all body muscles, skeletal muscles, pelvic muscles, all are weak and they lose their elasticity, elastic power of retaining. And if you do the exercise, pelvic floor exercise or Kegel exercise, that is very effective and it is globally recommended. And with this exercise, once your pelvic muscles becomes strong and becomes more healthy, more elastic, it will retain the urine. And even if you have some urge of urination, and it will not be followed of leakage. Leakage will not follow the urge and sensation of urination. This is the real problem, that if suppose we have the urge of urination, we are sitting in the meeting or with people, we can retain it, we can hold it for half an hour, 1 hour. But in the case of where all the system is weak, we are not healthy, everywhere there is weakness or sometimes infection, then immediately when the urge of urination is there, it will be followed by leakage. Even if you are rushing to bathroom, even, rushing means reaching there and you are just want to urinate, by that time it is already leaked. So that condition can be controlled by this exercise. You have seen the posture of your body, your leg and your hip portion, how they are hanging, and how you are holding with the help of your food. This position, this posture of your body is called Kegel exercise or pelvic floor exercise. Is one of the most important exercise to improve or to strengthen the muscle of your bladder, and it will help to stop the leakage of urine. A similar type of posture of the Kegel exercise, and you do at least 10-15 times every day, anytime, whenever you are on bed or on floor. This is very effective exercise for the healthy urinary bladder, and where all the nerves, all the muscles, elasticity of your bladder will be drastically improved. So let me see all these points what I have written here. These are all points we have to take care scientifically. Number one, maintain healthy weight. I have already told you that if you are overweight, you are at high risk of urine leakage. Number two, practice pelvic floor exercise or Kegel exercise. Just now I have demonstrated. Start doing general exercise and very specific exercise for your bladder. Number three, avoid bladder irritation. Bladder irritation is also one of the factors of urine leakage, and irritation may cause due to some carbonic or caffeine related drink, and stop it. Then number four, eat more fiber to avoid constipation. Once you have constipation, again you are at high risk of urine leakage. So in that case, you stop the acidic food like more roasted or fried, deep fried meat, red meat, and shift to more fiber. And number five, stop smoking and taking nicotine. Nicotine and smoking means also nicotine in the form of smoke. They are also one of the contributory factor for urine leakage. Sorry. Number six, take bladder friendly drink. It is having the same meaning what irritation. Bladder friendly liquid means water, simple water, or green tea, very light drink. There should not be any carbonation. That is called bladder friendly liquid. You should drink. Number seven, avoid pressure on your bladder and stress. Pressure and stress is only happening once you have the tendency or risk of urine leakage. Avoid any type of pressure. Pressure means you are sitting all of a sudden, sneezing, coughing, or loudly laughing. That put the pressure on your bladder, and it may happen that it may follow with the urine leakage. So avoid such type of stress, that is avoid bladder stress. And the coughing, sneezing, and laughing are the factors. Number eight, sudden urge of urination. Sudden intense urge to urinate followed by a leakage. Once your bladder is weak or you have some other health condition, this sudden this urge of urination will be followed with leakage. So avoid that condition. So, if you have the tendency of urine leakage, scientifically you can follow all these points what I have mentioned. Definitely there will be stoppage, and more especially you should follow the Kegel exercise Only you should check with doctor once there is some medical condition, that is maybe some infection or some diabetic condition, all those things. Otherwise, this scientific approach and lifestyle modification will help you a lot. With this, I will stop. Thank you very much for watching the lecture.